Ma'am, we are starting, ma'am. Smita, you can start.
Good morning, respected dignitaries, esteemed resource person, and dear participants. Every generation brings a new ways of thinking, a new way of learning, and a new opportunity for educators to evolve. With this inspiring thought, I warmly welcome you all to day 4 of our International Faculty Development Program series. I, Ms. Smita Kindu, Associate Professor at KD Institute of Nursing, KD Hospital, to be a host of today's session. Understanding Gen Z students, how they think, learn, and behave is highly relevant in today's educational landscape. As educators, understanding the mindset, expectations, learning preferences, and behaviors of Gen Z students is essential for creating engaging, meaningful, and student centered learning experience. It's my privilege to have with us Dr. Carolyn Mam. She serves She serves as a deputy director and head of the Community Health, Palliative Care and Research Division at Baptist Hospital, Bangalore. She is a distinguished public health expert with extensive experience in research, healthcare leadership, and medical education. She has guided 300 plus research studies and numerous postgraduate scholars. Ma'am has collaborated with WHO, Johns Hopkins, Harvard, Baylor, the University of Sheffield, and other leading global institutions. She is the author of 50 plus scientific publications in public health and healthcare research.
तुम्हें कितना टाइम
She
पता है
was
तो
recognized among the World Frontiers Forum Health Pioneers in 2021. Ma'am is also passionate about healthcare innovations, interdisciplinary collaboration, and mentoring future healthcare professionals. We welcome you, ma'am. Without further delay, I respectfully invite ma'am to take over the session. Thank you, ma'am.
Thank you. Thank you. Thank you for this wonderful invitation and also your. Shall I share this? Am I audible?
Yes, ma'am.
Okay. Are the slides visible?
Yes, yes. Perfect.
Okay. So without further delay, I would go into the today's topic, Gen Z, how they think, learn, and behave. So this session is a very practical and case-based approach so that we all can relate to. If you have, I think if there are any queries or interactions, you can we can keep it towards the end and have that discussion. So Gen Z, what is Gen Z? Who are these Gen Zs? So they're born between 1997 and 2012. That means the youngest Gen Z is 14 years old and the oldest is 29 years old. Now, if we look at any ecosystem, today's undergraduate students and many postgraduate trainees belong to this generation. They are the first true digital native generation, having grown up with smartphones, social media, high speed internet, and instant access to information. So, what are their characteristics? First one, they're very digital. Technology is an extension of their lives. They're comfortable with digital platforms, learn from videos, applications, podcast, AI, expert technology to support learning. What about other features? They're very curious, but also they question a lot. They rarely accept information simply because anybody in power says so. Then ask why. They verify information independently and they value evidence based practice. It's not audible?
Yes, ma'am. Audible. Yes.
Audible. Okay. Yes. Third one, they're purpose driven. They are motivated when they understand the importance of their work or whatever the studies that they take up. Want meaning in what they do. Also connect with patient stories and real life applications. Now, what is particular about this time? That is, for perhaps the first time in education, many of us are teaching students who have grown up in a completely different digital world than we did. The challenge is not to change it to our standards, but to bridge the gap between both generations. So mostly the faculty, they're not Gen Z, right? The faculty is either Gen X or millennials. That means we learn from textbooks and lectures. We respected hierarchy, and usually we do study or we do certain things, and we need only delayed feedback. It is not that when as we are doing, somebody is giving feedback, and it's mostly the teachers develop the curriculum, they driven it, and it's a teacher centered education. And as we grow older, we started getting enabled into the technology. Now, what about Gen Z's? They are not learning from textbooks and lectures, they also learn from multiple digital sources. More than hierarchy, they want dialogue, they want explanation, they want conversation and feedback. They don't want to be actually finishing everything and get a feedback like exams, or they want, when they're doing procedures, when they are doing certain things, the feedback then and there. And the education is a learner centered education, means they actually drive it by asking questions. And technology, as we earlier said, has always been part of their life. If we look at peer active learning is an important concept in their learning. Uh, Passive lectures, that is just, that how we used to learn, they're less engaging for them. They learn by in other ways. One is case discussions, simulations, demonstrations, or they have been given as a team a task and they actually do it, or reflections. So there is an active learning from their side. That is what their preferred mode of learning. The other one, again, they expect feedback. They appreciate regular coaching, timely feedback, clear expectations, and is waiting until the end of rotation to give back is often less effective. So if suppose they are doing a procedure, what they would expect is they have been demonstrated the procedures, and as they are doing, somebody giving their feedback. That is what their feedback expectations. Also, they value relationships. They appreciate faculty who are respectful, approachable, fair, consistent. They do not expect faculty to be friends, but do expect mutual respect. So, if you look at it, they are more into having a respectful relationship than a very hierarchy oriented relationship. They're also comfortable with diversity. They have grown up in a more diverse and educational and social environments and generally expect inclusion and respect for different backgrounds and perspectives. And another thing that they always say is they value work life balance. So, compared with the earlier generations, many Gen Z learners place greater emphasis on balancing academic, professional, personal life. This can be interpreted as by older generations as lack of commitment, although it may reflect different priorities rather than lower standards. So, when we interact with them, what they say is that we have other hobbies, we want to go somewhere, we want to see the world. or we want to write, we want to paint, we want to do other things. It's not that I have less interest in academic, but there is also, I want to have experience other experiences also. So there is a need for, they usually very vocal about work-life balance. So what are the Gen Z's strength? They adapt quickly to new technology, strong problem solving skills. They're very collaborative. They're comfortable with innovation and open to lifelong learning. They value patient centered care and social responsibility. So, but there are some challenges also. Uh, they are having very short attention span. So if I have to take a Gen Z class, it has to be 10 to 15 sessions. It has to be more of their reflection and my reflection. That is more effective rather than a one-sided a long lecture of 45 minutes to 1 hour. So that is how their attention spans are very shorter. Another thing is dependence on digital devices. So digital devices, in the sense like they have been grown up with the things, so they like to be visual. They also discuss among each other through multiple digital media. They may appear very confident, but also they have a big fear of failure. So you can see them very confident one with the mental health risk and stress associated thing. So that is also very typical of Gen Z. We already discussed preference for immediate feedback. So sometimes in our work settings or in our teaching settings, this may not be practical. Like if we have 20 people in the class and then multiple people are doing multiple things, it's very difficult with the current faculty ratio to give immediate feedback and observing them on a one-to-one basis and give feedback. So these also create sort of challenges in our learning and teaching environment, and also difficult coping with prolonged uncertainty. They want answers, they want things to be sorted out. Sometimes in life that doesn't happen, and there is a prolonged anxiety with that. So, what is the complexity of the setting? That is, most faculty today belong to Generation Y or millennial cohort, with a smaller proportion from the baby boomer generation. But your students, however, are predominantly Generation Gen Z. So, why this matters? Each generation has been shaped by different experiences. We cannot say that one generation is correct and the other generation is wrong. But the way we experience our and we express our emotions is different. So it's important that as faculty and as teachers, we understand Gen Zs and the way they learn. It is important for us to incorporate those methods in our teaching so that they can take the maximum benefit out of it. We have discussed about it, about Gen X and millennials and Gen Z, who are mostly digital and want good feedback and more of dialogue and explanation and learner-centered education. So what we have to do is to bridge the gap between the generation, because many of these teaching students who have grown up in a completely different digital world than we did, and we cannot expect that how we learned, that is the way they will learn. No. So the challenge is for all of us is not to change our standards. What is needed to be done in our clinical setting has to be done. But the way we teach and the way we give feedback has to be different to bridge the gap between the generations. Even though there are different ways of expressing our values, our core values have not changed. Whether it's Gen Z or the millennials or the Generation Y, it has not changed, because the compassion, integrity, patient safety, professionalism, excellence, accountability, these are the core values, and no matter which generation our students are from, they actually respect these values and these, but only the way they express is different. So we will look into each of those things and discuss a case discussion on each of those values, how we think or how the faculty think and how the Gen Z thinks. This is a final year nursing student spends an extra 15 minutes talking to an elderly patient who is anxious about going home after surgery. As a result, she is late in completing her documentation and other patients' documentation. The faculty says, your first responsibility is to complete your assigned work on time. The student replies, patient needed someone to listen. This was also nursing care. What do you think? Can anybody tell what is it a common condition, or what do you think about this particular case? You can unmute, anybody can unmute and give your views about this case. Is the student wrong or is the faculty wrong? Anybody here who want to share your thoughts?
They are writing
Am I?
chat. They are writing in the chat actually.
Okay, okay. Somebody can read out? 1 second. Otherwise, I have to escape and see the chat. No one is wrong about but communication. Okay. More. Anybody else? Okay, some chats. Let me see.
One has written it is good that student gives importance to human values.
Yes. Student is okay. That's a no one is wrong. It is good the student gives importance to human values. Correct. That is correct. Human values is more important. Okay. Okay. So yes. So do you think that faculty is wrong? Faculty had asked the question that you have not finished your documentation. Let's see. No, faculty is not wrong. So that is so we are seeing that. So this is exactly our usual situation is that we cannot say that it is anybody is wrong, but we also have to resolve it. So this is the thing I want to say, that faculty's perspective, that is compassion. Faculty is saying that compassion includes being dependable and completing responsibilities on time. Good nursing means balancing empathy with efficiency. Other patients also deserve timely care. So if you're going to spend more time on this particular patient and that the discharge is delayed, it has an effect on other people. They may get delayed. So faculty is focusing on serving all patients through efficient care. Whereas students' perspective is compassion means being emotionally present. Listening is an important as performing procedures, and human connection is a part of healing. So student focuses on the needs of the individual patient. So how do you resolve this? Both are looks like okay and correct. How do you resolve this? So this is what the faculty can do. I appreciate that you recognize the patient's emotional needs. Sitting with an anxious patient is an important part of nursing care, and your compassion is evident. At the same time, as a professional, you're responsible for all your patients. When one patient needs additional emotional support, think about how you can provide that care while ensuring that your other responsibilities are not delayed. If you anticipate needing more time, communicate with your team so that patient care remains safe for everyone. So here, what we have done is, it is you are recognizing what student or has done in good faith, and you are encouraging that, but at the same time, what the faculty had a perspective, putting that others are delayed. So next time the student will be more careful, when at least otherwise tell other people to look after the other patients, or actually send this patient to a counselor, or different things can be looked into it. So this is how we can resolve this. So again, it was compassion, but how Gen Z looked is different. and how a millennial or other generation looked was different. So this is one exact case study. Second one is case 2, integrity. During a medication round, a student notices that the dosages in the chart differs from the electronic prescription. Instead of following the instruction to give it now and we'll sort it out later, the student pauses and asks for clarification. The instructor later comments, "You should trust your seniors." The student responds, "I wanted to make sure that we give the right medication." Again, we can see at look two perspectives. Faculty's perspective is respect the chain of command, clarify concerns appropriately, trust experienced colleagues while raising questions professionally. So, faculty often expresses integrity through professional responsibility within established system. Whereas, look at the student who's Gen Z. Speak up if something appears unsafe. Verify before acting. Patient welfare comes before assumptions. Student may express it through transparency and questioning when uncertain. Again, we can see two perspectives. Both are right in their own sense, but it can also cause challenging situations during in our learning or learning setting. So how do you resolve this? So here I am glad you post before administrating the medication. While something doesn't seem right, verifying it is the current thing to do because patient safety comes first. So as you grow professionally, you will also learn how to raise concerns in a way that maintains respect and teamwork. Instead of saying you are wrong, you might say, "I'm noticing a difference between the chart and the electronic prescription. Could we verify it together before I administer the medication?" So this is the faculty dialogue, which can be used in a way that is aligned to the Gen Z. Gen Z is okay because you're saying that this is okay to pose and ask question. There's the hierarchy, more than hierarchy, patient safety is important, but the way you say it, should be important also. So integrity means speaking up respectfully for patient safety. So interruption is possible, but speaking up respectfully, like "you are wrong," those kind of things may be avoided. So this is how in a facility, when we have teaching interactions between Gen Z and other generations, this can be used. Next case, patient safety. Okay, so this is another case scenario. Before inserting a urinary catheter, a student pulls out a mobile to check the latest hospital protocol about inserting a urinary catheter. The faculty member says, "Keep your phone away during clinical posting." The student explains, "I want to make sure I remembered every step correctly." What do you all think about this situation? Do you guys encounter
Superficial,
such
deep,
thing?
very good. Yes. Yes, yes. Okay. So as you know, the light palpation is done with the fingertips like this, with using
Uh, what do you think about one should have a okay, mobile's phone should not be used during clinics. One should have paper for SOP. Okay, so there are, so yes, we always face this. So here the difference is the student is looking for a gadget, and whereas faculty prefer a paper, right? But it is looking at a different things as you're doing. So this is, we face it because Gen Z's has always a thing of they really want to actually go and look into the so let's see how can we resolve. Is there anything if such a situation comes, what should the faculty do? How do we resolve this? So the student side, so we'll have to look why is student doing this? What is the reason? Can you see my slide? Yeah.
Yes, ma'am.
So the faculty's perspective is phones are associated with distraction. Clinical attention should remain on the patient. Safe practice requires focus. So faculty associate safety with undivided attention and disciplined practice. Whereas students' perspective is technology can improve safety, checking a protocol reduces the chance of mistakes, reliable information is immediately available. So student associates safety with using available evidence and digital tools. So it is focus on one side and in discipline practice. The other one is using what is a gadget which gives them a safe solution. Now, how do you resolve this? So faculty can say that I appreciate that you wanted to check the latest protocol before proceeding. That's a good habit. At the same time, fonts can easily be misunderstood in clinical areas. Let's agree on when and how mobile devices can be used professionally so that patient confidence and team expectations are maintained. So technology should enhance, not distract from patient care. So mostly what happens is that we get upset when the students take the mobile phones and we actually snub them. So, and again, they will do it. Whereas when we have this kind of a resolution where we say, checking is good, but phones can be misunderstood in clinical areas. So we can have a discussion on when and where can be used and bring out a protocol. Then at that time, Gen Z also understands that the patient may not like it and it can have all kinds of problems. So it's we are resolving through a dialogue. So that is the one way of doing. Okay. The next case scenario is professionalism. A student addresses the faculty member by saying, good morning, ma'am. The student is respectful but speaks comfortably, asks questions freely, and occasionally messages the faculty through WhatsApp about academic matters. Some faculty appreciate the openness, while others feel the student is becoming too informal. So I know in every setting, WhatsApp and other things we allow, but there are situations in which people find it difficult to. Sometimes the students do not know the boundaries, and they start asking more and more things, and becomes a friendly kind of an interaction. So have you faced these kind of? Have you faced these kind of things? Oh, can't see the slides. Okay.
Ma'am,
Yes.
slides are
Okay.
not visible.
Not visible?
No, ma'am.
Now?
Yeah, now visual.
Yes, ma'am. Now it's
Yes. So just wanted to know this particular thing. Yes. Do in your setting also is does the student sometimes the boundaries is little made fluid kind of thing? You feel like that in certain times? I'm looking at the chat. That is why I just yeah, one needs to maintain the boundaries of etiquettes, but usually we don't have these kind of conversations with the children, students. So what happens is that they also start interacting like peers. So how do you resolve, and why do students do this, in terms of their so faculty's perspective is professionalism includes a kind of formality, appropriate distance, preserve respect, clear boundaries, support effective learning. Faculty may equate professionalism with formal relationships. Now, students' perspective is professionalism includes respectful, open communication. Approachability and availability encourages learning. Questions are easier to ask in a supportive environment. Students often associate it with respectful collaboration. Now, we know there should be boundaries because we are not their peers. So, the case resolution is you may have to have this conversation if anybody step into your boundaries. That is, I'm pleased that you feel comfortable approaching me with questions. That openness supports learning. At the same time, maintaining professional boundaries helps preserve respect for both students and faculty. Let's discuss what professional communication looks like in different settings. So, I don't know, many times what happens is that if there are issues, we usually do not, we get upset that the student has crossed the boundaries, but we usually do not have a discussion as what is a right way of, it need not be done as a one-to-one also, but as a class, you can discuss what is professional boundary mean. So that is another way of actually, resolving these kind of issues. We should have, yes. Next one. Now the case 5 is about excellence. A student prepares for a clinical case presentation using textbook, journal articles, hospital protocols, and AI to organize the information. The presentation is excellent. The faculty member asks, "Did you write this yourself?" The student replies, "I used AI to help organize my ideas, but I verified everything." So, do you come across such situation? Do you come across people using AI and other things for, yeah. Okay. So what is that if somebody says that makes exceptional presentations, exceptional write-ups with AI, do you have any reservations? What do you tell your student? The student says, "Yes, I used AI." Very often nowadays, mostly students do that. Yes. So is it a problem? What do you tell to the students? I'm waiting for some chat to come. Some many people said that yes, we the students use it nowadays. But is do you speak to students? Do you see any concern? Okay, so some students don't accept that they use. Okay, one faculty says they can use, but they should be able to understand what it wants to convey. Okay, what it wants to convey. Okay, how do you do that? But they also need to use journal and books also and other research, correct? They should use journal, books and other research, but apart from that, if they use AI also, how do we deal with that? Okay, let us look into, yes, Geeta, you can, yes, please.
Type your responses. Only then I can see how many of them did you write response.
So,
Shall I, ma'am?
sorry?
Yeah,
Shall
very
I?
good.
Yeah. Anyone puts any command, AI comes. But what we want, the prompting
5
is
to 35. 35 sounds component. Yeah. Yeah, very good.
So
So
any
visual
prompt, anybody,
examination of
yes.
rectum is
No, I
done
didn't finish,
using
ma'am. Let me complete it, ma'am. So prompting is one thing. That further they need the basic book text.
audio not heard up.
The textbook reading.
If one person can speak,
Yes.
yes. So yes, you can continue.
Be based on what they read in the textbook. Because whatever the question comes, it will not be personalized. It will be a gender thing that everyone are speaking.
Okay, so you feel that using AI,
The journaling and the textbook will help a lot. Just AI will not be of helpful.
yes,
Otherwise,
just
every
AI
other person will have.
Okay, you're thinking that if they use the AI, everybody's answer will be almost the same. Is that what you think? That may be a point, and it's not okay. Anybody else wants? That is a good valid point.
Ma'am.
Any other?
Ma'am,
Ma'am,
nowadays AI is very supportive to the students and faculties also. They can use AI to one topic which they are not understand easily, and they can make more interesting their topics also.
Okay, so there are two aspects. You are saying that AI can be helpful for both faculty and both the students. That is what your take on it. So if a student use
Yeah.
AI, you have any problem with that?
No, ma'am.
No. Okay. Uh,
But they
so
can
if
use their wisely. They can use their AI or whatever they use. It should be authentic, and they are validated by textbook or other things.
okay,
Whatever they
okay, some
learn
of
from
the
AI.
the only yes, please Neela Ben Darji, you can please.
It
You
is
have a
good to
question.
use AI.
Hmm.
I won't have a question. It is good to use AI. What the student did, they just copy paste it. They have to
Hmm.
refer the material after copy pasting, and extra they have to delete it, and other things they have to add it by using some textbooks or reference. Just only the copy paste is not good for it. Otherwise, AI is good.
Okay. Okay. So there are so what is there is an ethical and a responsible way of use. So if you're asking a question, if suppose you want to have an assignment on a certain things, uh, telling the AI to make the entire assignment is a problem. That's not it's not ethically allowed. But if you write, you have first your thought process, you have multiple sources, you verified and put all those things in the AI. AI is using for your language, your it's the content of it is yours, and it is modifying and presentations is made better. That is allowed. Second is what is available for AI is things which are available vastly. It is even in a conversation in Facebook, everything. So if there are a lot of conversations saying that in the public realm that if you eat mango, people get cancer. If suppose suddenly everybody start thinking about it, the AI picks up that and put it, or sometimes it hallucinates. It create its own contents, wrong content. So anything that we create using that, we have to check with the facts whether it is correct or not. So that is how you're supposed to use it. So let us look in this particular case. This particular case, the student says, the faculty asks, did you write this yourself? The student says, I used AI to help organize my ideas, but I verified everything. So organizing, so the idea is the student's, but the student is verifying everything. Hmm? Now, faculty is excellence is built through personal effort. That is how usually faculty think. Deep understanding comes from reading and reflection. Original thinking is essential. That is correct only. Faculty often value mastery through disciplined study. Now, students' perspective is excellence means using all available resources wisely. AI is a tool, not a replacement for judgment. Efficient learning leaves more time for application. So, student value mastery through efficient use of technology and multiple resources. So, the case resolution, what can we tell the student? Using AI as a learning aid is becoming part of modern practice, provided if it is used responsibly. My expectation is that you understand the content, can explain your reasoning, and verify the accuracy of the information. AI can support your thinking, not replace it. So, excellence comes from critical thinking, not simply from using or avoiding technology. So, this is an important thing and it's very relevant in today's time. The next case study is on accountability. After completing a busy shift, a student tells the faculty member, I'm feeling mentally exhausted. I don't think I'm in the best state to perform another procedure safely. The faculty member says, when I was a student, we worked much longer hours. The student responds, I want to provide safe care and I'm concerned that fatigue could affect my performance. What do you tell about this case? Okay. Dhruv says allow the student to relax. Okay. Everybody is of that opinion? Any other opinion? You're all very good faculty. Everybody wants to give because health of the individual is first priority. But are we able to do that and give the student those spaces? Okay, let's do what is each person think about what is the faculty. So usually faculty's perspective is accountability means fulfilling one's duties despite challenges. Resilience is a part of professional identity. Patient depend on healthcare professionals. So faculty expresses accountability as perseverance and reliability. Now student perspective is accountability include recognizing one's limitations. Fatigue can compromise patient safety. Asking for help is responsible professional action. So students may express it as self-awareness and safe practice. Now, both are true or correct in their own way. So how do you resolve this? Thank you for being honest about how you're feeling. Recognizing your limits is an important part of professional accountability. Let's think it together about how to manage fatigue while ensuring patient care continues safely and reliably. So, here accountability includes owning responsibility, recognizing limitations, and communicating appropriately. So, some of the communication things that we have to look sometimes is saying, avoid saying like you are wrong. This is not how we do things. Don't use your phone. You are too emotional. You need to toughen up. Don't use all. If even if you want, if somebody is doing wrong, you have to say your intention is good. Let's refine our approach. This is not how we do it. Instead, we can say, here is why we do it in this way in clinical practice. Let us discuss when technology supports safe care and when it becomes a distraction. So instead of using do not use your phone, you can say, let's discuss how to use technology in clinical settings. Like you are too emotional. Somebody says that, I can't cope up with it. So empathy is a strength. Let's learn how to balance it with clinical responsibilities. You need to toughen up. Well, resilience is important. Let's build it while maintaining patient safety and your well-being. So here, that perspective, the way we say makes a big, big difference to Gen Zs. So one of like we discussed how the Gen Z think and how they want the feedback. Some 2, 3 core things I want to talk about: teaching, feedback, and exams or assessments. So teaching, capture attention. So that is first thing. So basically they like stories or a real clinical problem. They are not a fan of factual things written out in slides after slides. Second, explain. Teach the key concept in short, focused capsules. Apply, use a case, simulation, or bedside demonstration. Practice, let students perform the skill or solve the problem by themselves. Provide immediate specific coaching and reflect, ask what they learned and how they will apply it. So you can think whatever lecture you do, whatever case present, whatever you do for a teaching purpose, if you're doing to Gen Z, please keep this framework in your mind. So the teacher's role is changing. Traditional is a source of knowledge. Now you can get in internet all the knowledge. So he's a curator or interpreter of knowledge. He or she is a facilitator and a course, an assessor and a mentor, not an examiner. And more than authority, they wanted a trusted expert and a role model. So Gen Zs doesn't need less knowledge. They also want to learn, but they need knowledge that is relevant, active, and applied. And our job is not to simply transfer information, because that they get in any, you can open the internet, you get information, but to develop clinical reasoning, professional judgment, and compassionate practice. Now, if you have to give feedback, they're doing a procedure and or something, and you want to give a feedback. So ask after the procedure is done to the student what went well. Then faculty also adds positives which the student missed. Then student identifies area of improvement, what all was like lacking. Faculty also add suggestions and agree on an action plan forward. So this is the way we should give or feedback to the Gen Zs. Now comes the examination or assessment. So traditional assessment is what do you know? Can you memorize? Asking definitions, recall, one exams, and give marks, and teacher is the judge. Whereas what Gen Z says is competency-based assessment. What can you do safely? What is the application of this knowledge? There should be a way of continuous assessment, how the student is in what trajectory improving, where it's static. Instead of marks, what all things with competence and safety that they can take, they can do it. That is competence. And the teacher observes, coaches, and assesses and give feedback and improves. So that is how the assessment is looked into. So every generation has something to teach the next. Our students bring curiosity, digital fluency, and new perspectives. We bring experience, clinical judgment, professional values, and wisdom. So, our role is not to change the next generation, but to bridge the gap between generations, preserving the values of nursing and other or medical profession while adapting the way we teach. And Gen Zs don't need different values, they need different ways of teaching. And our responsibility is to preserve the timeless values while embracing teaching methods that prepare the next generation for the future of healthcare. So sometimes we think that whatever in the textbook, all the knowledge is there as knowledge. So do we matter as faculty? No textbook or AI can fully teach these through information alone. They need to know when to act, when to wait, when to ask for help, how to communicate, how to comfort a frightened patient, and how to make ethical decisions under uncertainty. And this only through the mentors, through the coaches, the faculty that they can learn. So, do we matter? Knowledge is everywhere, but students may learn anatomy from a textbook, pharmacology from an application, procedure from a video, but they learn compassion by watching us, integrity by working with us, and professionalism by being mentored by us. So the future will not need few educators. It will need educators who teach beyond information to wisdom, judgment, and character. I think that's my slide. I'm open for discussions. Respect students' feeling, but if repeated behavior, then one must check the reasons behind such. True. So, as a part of feedback, we have to actually tell the student also feedback you are not doing, it is not right. And after feedback, you have to ask and you have to do what is required. Yes. I can't see any other comments or any questions.
A few questions to ask to you, ma'am. How far do you think that AI can enable the student for transformation?
Transformation means what, ma'am?
Transforming in the sense as practically oriented, knowing the psychosocial aspect and economical condition of the, like, and I'm saying that human touch. Not knowledge gives so many information, but practice gives them the transformation. For that, how best AI can be used, how best the faculty will be of useful. No, how far you can integrate those two?
Those two. So I would say now AI has as a basic foundational thing. It cannot enhance you. It will give you time. So I can use maybe 1 hour to make a presentation. If I know how to use AI effectively, I can create it in maybe 10 minutes. So the rest of the time I can use it for interactions, human interactions. So one way it improves the efficiency, that is, but we can never replace AI with human touch. That is completely, it is a different angle altogether. AI is like a foundational architecture, like electricity. Now, what is electricity? Electricity does not make you, it is everybody needs to know, everybody should, so many other things has to work because electricity is there. So the way the science is going is that AI will be a pervasive all in our life, but that is not the quality of human beings as a faculty, as a human, as a doctor, as a nurse, as a radiographer, that is going to make a biggest difference for the patient.
I want to add one point, ma'am. This
Yes.
AI or the books or textbooks or journals will be developing their logical point of view. That is left brain
Yes.
will be there. For right brain integration should be there for transform. You asked me, ma'am, what you mean by
Yeah.
transformation.
Yes. Yes.
There should be a
Yeah.
proper correlation of right brain and left brain. For right brain,
Yes.
that faculty, that atmosphere she has to create. She or he should create. Like she
Yes.
has to create situation on sim like what you say.
Yeah.
Yeah,
Creativity. Yes.
simulating an
From.
exact family condition, role playing. So it can again it cannot be the same thing because same every family has their own distinction. So we can give
Yes.
different types of culture people how they handle. One formula they cannot establish in every
Yeah.
other patient. So that distinction all the teacher only can do that. That right brain integration, then transformation occurs. That's what I want to say, ma'am.
Yes, yes. Yeah, of course, teacher as a live human being, giving from their example and bringing those perspectives, definitely. But AI also AI is not a uniform thing. AI, how we think, it's like a artificial intelligence, the way you give 100 types of patients, feed into AI will create 100 types of people and simulations. So AI can also, but the creativity, who has to give this data?
Yeah.
It's humans who
Yes,
are
yes.
feeding these data. So that definitely you can't, AI can't replace humans at this moment. Yes. Yes. There is definitely a value for a teacher. There is no doubt about it. Yes. I think there are no questions.
Hello, ma'am.
Yes.
Then actually nowadays we are facing lots of problems during clinical duty, clinical posting. In clinical posting, students are not interested to touch patient and care of the patient. How can we resolve this solution? There are so many faculties in this platform. I just want to know if this problem is happening in our institution or any other institution also face this type of problem.
So for the students do not turn up for clinical classes. Is that what you said?
Yeah.
Okay. So
They just want to stick on theory classes and in clinical they are not attached to the patient.
mm. Okay, so basically, what happens is that uh, what they're doing is that it is not interesting enough for them to come. The first thing I would say, have an open
Yeah.
conversation with students. What are the reasons why? So, for example, if I put myself in their shoes, okay, examination of or doing a procedure, I can do sit at home and actually watch a video. Okay, that is one thing.
Yeah.
So people may opt for that. But my question is, if you tell the students, like how much ever you simulate or know the technique theoretically, doing it has a value, right? So
Yeah.
we may have to make them understand and give them chances so that they learn by doing. So we have to make it you can have a conversation. You can one day take it them for a kind of a external place, a park or somewhere. You can just go and have a one-to-one conversation how to make it, because you are also doing it so that they learn better, right? You can hear their
Yeah.
perspective and see whether you can work around it. Most times that is because they find it monotonous, so we have to make it more creative and ask them itself to how do they want it, and see whether it's practical or not.
Yeah.
I hope whatever I have is I try to be as practical as possible and not theory and scenarios that we usually encounter. So I hope that you could all relate to what I just shared.
If any participants have any query or want to share any experience regarding today's session, they may ask.
Thank you.
I think so. There is no more question, ma'am.
Yes.
Okay. So thank you so much, ma'am, for such an insightful and engaging sessions. Your valuable insights and regarding case scenario, what you have taught, uh, have enriched our understanding of today's learners and will certainly help us to become more effective educators. So, behalf of the organizing committee, I extend my heartfelt gratitude to Dr. Caroline George, ma'am, and all the participants for their enthusiastic participation throughout the session. Thank you, ma'am. Before leaving,
Thank you.
yes,
Mhm.
before leaving the session, kindly take a few moments to please fill the feedback form. I think so, which has already been shared in the chat box.
Thank you so much, ma'am. Mm,
Thank you.
Or on behalf of KD Institutes, once again, as a principal, I extend my heartfelt gratitude for sharing your expertise. Because what made today's session particularly meaningful was the way you translated the concepts into real life practice to the case scenarios. And already we had, when you committed for taking the session, we had already told you about this case scenario discussions, and you perfectly did it, ma'am. And so I'm sure that participants also will take back valuable strategies to build a stronger relationship with the students, and we can communicate more effectively. So once again, I thank you, ma'am, for an inspiring interactive sessions, and thank you all participants for your active participation through the session. Because what we understood from this, that when we understand the generation we teach, we don't have to lower our standards. We simply learn better way to inspire them. So that way you have covered it, ma'am. Thank you so much, ma'am, once again, on behalf of all institute. Thank you.
Thank you so much. It was a pleasure talking to all of you and listening to your comments. And it's a very good topic. Even I learned many times as I was making the scenarios. I myself thought, how would I react? So it was actually learning for myself too. So thank you very much. And thank you.
Ma'am, I joined
I-
later part of your lecture. May I know where you are working, ma'am?